So, good morning. Today's session is the session on health and social care context, and it's the assignment discussion today. And I'm just going to go through the unit aims and things like that, and then we'll go we'll go through the assignment with you, okay? And it will be looking at all the learning outcomes, what we've completed in the last 4 sessions, and looking at the different outcomes when doing the assignment, okay? So the unit aim is to develop an understanding of health and social care in which students would like to work. They will develop their understanding in order to critically evaluate the impact of legislative frameworks in the context of local practice. And learning outcomes. So learning outcome 1, which we went through, was to understand the structural organisation of a chosen health and social care area. 1.1 was to analyse organisational structures within the chosen area. 1.2 was to evaluate the roles and responsibility of the agencies external to the area who advise it. 1.3 is to analyse individual functions and roles within organisations in the area. Learning outcome 2 is to understand the implications of legislative frameworks in the chosen health and social care area. And 2.1 is to analyse the legislative frameworks impacting on the chosen area, explain their intended functions, things like the legislation and things like that, and the legal frameworks. 2.2, to evaluate the way in which legislative frameworks have interpreted in terms of regulations, codes of conduct, codes of practice and standards in the chosen area. 2.3 is to assess the impact of policies, legislation, regulation, codes of practice and standards on organisation and working practices in the chosen area. Then we've got learning outcome 3, which was to understand external influences on a chosen health and or social care area. And we looked at 3.1, which is to analyse the factors and organisations which have influenced government decisions on health and social care. 3.2, to assess the impact of social values and attitudes on health and social care. And 3.3 is to assess barriers to access for health and social care and how effectively these have been overcome. And then learning outcome 4 was to understand the individual rights underpinning the delivery of health and social care to service users. 4.1, to analyse the individual rights that underpin health and social care practice, and 4.2, to evaluate the importance of these rights in health and social care. The indicative content in regards to this, so for learning outcome 1, we understood the structural organisation of a chosen health and social care area. The area we looked at, this will be specific area of health and social care, for example, care of children, of young people or elderly. Organisational structures include private, public funded provision, for example, individual organisations, hospitals, care homes, daycare centres, home care organisations. We looked at groups, for example, healthcare trusts in UK, private healthcare groups, charitable organisations such as Barnardo's, Help the Aged and UNICEF. We also looked at the roles and responsibility of agencies which are external to the area, for example, government departments, Department of Health in the UK, the health and social care organisations such as NHS, healthcare trusts, regulatory bodies such as Health Protection Agency, professional bodies such as the Royal College of Nursing, guidance bodies such as National Institute for Clinical Excellence, international bodies such as the World Health Organization, charities such as Multiple Sclerosis Society, UNICEF and Barnardo's. We looked at the individual functions and roles under learning outcome 1, which was internal structure, so the hierarchy of the governance and management, the functions, administration, finance, delivery, the roles of managers, administrators, doctors, nurses and care workers, Then in learning outcome 2, we looked at understanding the implications of the legislative frameworks in the chosen health and social care area. We looked at the legislative frameworks to include legislation such as, remember, the Equal Pay Act and Equality Act, regulation, codes of practice and standards in the chosen area of health and social care. For example, laws relating to disability, health, data protection, discrimination, human rights, child protection, and health and safety. We looked at the explanation and the role of each of the above. We looked at policies, codes of practice and standards and how they link with legislation and regulation and practice. The intended functions of legislative framework are to ensure suitable provision, to ensure best practice, to ensure fair access, and to ensure relevant professional body membership and to comply with the law. Interpretation to include how legislation has been put into local guidelines and dissemination to the relevant personnel such as the owners, managers of provision. For example, students may analyse particular standards that have been devised to govern the way in which severe provision is run and the standards of care they provide. The impact on working practices, so it helps ensure compliance, helps ensure consistent, good standards of work, of care, professionalism, and how they can limit service offered. Learning outcome 3 was to understand external influences on a chosen area in this health and social care career. Influences may include individual government organisations, pressure groups, charitable organisations, limits to government's freedom to legislate in terms of international laws. European laws could be an example. Statistical and evidence-based research that influence decisions and demand for provisions, and demand for health and social care, such as, the increase in population, the epidemics such as COVID, lack of food or clean water. Social values and attitudes could be example, cultural beliefs and attitudes towards health and social care generally. And then you have towards public health issues, towards funding for health and social care, so private and public sectors, towards disability, so the social model of disability, towards gender issues and health and social care, towards the big society, which David Cameron was involved in regards to that, towards the responsibilities of government against the freedom of individuals. And there were barriers to access may include disability, class, wealth, gender, age, language, beliefs and values of individuals and or families when accessing provisions. Number 4 is to understand the individual rights underpinning delivery of health and social care to service users. Individual rights will depend on context, but examples are equality of access, rights to choice, right to dignity and respect, empowerment of service users, the right to safety and needs of assessment, confidentiality, a person-centered approach, any rights conferred by legislative frameworks such as the UN Convention on Human Rights, so the rights of the child, dignity, freedom, fairness. These are all rights under the Human Rights Act. The importance of this was to ensure health and social care needs are properly met, to ensure access to suitable services by service users, to ensure tensions between what can actually be provided and the rights of individuals, and protection of vulnerable service users, and to ensure that development and care provides the best possible outcomes. So these are the 4 main learning outcomes that we've looked at in the sessions as well. And you've got access on Moodle to the slides, okay? Now I'm going to look at the assignment area, okay, for you to go around, okay? So I'll stop that one and I'll start this one. No, so stop sharing that. That's again, we share the wrong stuff. Just 1 minute. So go to this. Right, can you see this, Eunice? Yeah. Can you see this? Yeah, now, Eunice?
Yes, please.
Okay. Have you got any questions on the learning outcomes we've just been through?
No, it's no.
No?
Yeah.
You haven't got any questions, no?
No.
Okay. So this is the assignment that you need to complete after completing the 4 learning outcomes. This is the assignment. So it's unit 4.25, health and safety in the health and social care workplace. So to succeed in this assignment, you are required, to succeed in this assignment, you are required to complete 1 assignment. You must ensure that you cover the assessment criteria for this unit in this assignment. This is the right one. Just 1 minute. One minute, let me just see if this is the right one. It should be. Just 1 minute, Eunice. Social care setting. Okay, Okay, can you just give me 1 minute? Just want to make it clear that this is the right one, Eunice, yeah? Just give me 1 minute. Just so we're going to go through the assignment now. So it's a health and social care and context assignment, level 15 credits, and the context of this assignment is, firstly, it's a scenario and then the tasks will follow, okay? So a local television company has decided to make a documentary about an area of health and social care. You have been employed as a researcher to produce materials and information which will then form the body of the documentary. You do not have to make the documentary. You can choose the area of health and social care you wish to research, for example, care of elderly or health or social care. Okay, so you might consider the following. You need to carry out a research and produce materials for the documentary. You might consider the following: interview notes or recorded interviews, interview questions, comments or quotations from individuals, organizational charts with explanations, detailed notes for the documentary maker, scripts for sections of the documentary, and this list is not exclusive, so there can be more. So task one, in task one, you need to look at the first part of the documentary about the structural organization of the chosen area. Your research and materials must cover an analysis of the organizational structures within the chosen area, including private and publicly funded provisions, and an evaluation of the roles and responsibilities of external agencies who provide advice and influence, for example, government departments, regulatory and professional bodies, and an analysis of individual functions and roles in organizations within your chosen area. So this task covers learning outcome 1.1, 1.2, and 1.3. So we look at the different organizational structures within a hospital, and we looked at the different roles, and this was in learning outcome 1. Okay, so this area covers learning outcome 1.1, 1.2, and 1.3. Okay.
Okay.
Task 2. The second part of the documentary concerns the implication of legislative frameworks. Your research and materials for this part of the documentary must cover an analysis of the legislative framework impacting on your chosen area and an explanation of their intended functions. So can you remember any of the legislation we looked at?
I'm sorry.
Can you remember any of the legislation we looked at in this area? Equality Act, Health and Social
yes.
Social values. So these are the things you need to look at.
Okay.
An evaluation of the way in which legislative frameworks have been interpreted in terms of regulations, codes of conduct, and standards in the chosen area. You also need to look at an assessment of the impact of policies, legislation, regulation, codes of practice, and standards on organizations and working practices in your chosen area. And this part of it covers learning outcome 2, and it covers 2.1, 2.2, and 2.3. Okay? Is that okay, Eunice? So that's looking at the legislation, what is used within your health and social care area, why there's a need for legislation, and why we have codes of practice and regulations in place, okay? So this area is task 2. Task 3. This is the third part of the documentary, focuses on external influences on your chosen area of health and social care. Carry out research and produce materials for this part of the documentary. Your research must cover an analysis of the factors and organizations that influence government, things like pressure groups and stuff like that, okay? Decisions on your chosen health and social care areas. You also need to have an assessment of the impact of social values and attitudes on your area of health and social care. You also need to look at barriers, an assessment of barriers to access for health and social care and how effectively these have been overcome. Okay, and this will cover learning outcome 3, and it will be learning outcome 3.1, 3.2, and 3.3. Okay, so this is task 3. This will cover learning outcome 3.1, 3.2, and 3.3. Okay. Then we go on to the final one, which is task 4. And the final part of the documentary is about individuals' rights and underpinning the delivery of the areas of health and social care to service users. You should carry out research and provide an analysis of the individual's rights and underpin health and social care practice. You should also have an evaluation of the importance of these rights in health and social care. Okay, and this covers learning outcome 4, and it'll be the task covers assessment criteria 4.1 and 4.2. Okay, so these are covering them elements of it. Please note that your assignment must be accompanied by a bibliography, and you are using the Harvard system of referencing. Okay, so you need to have a bibliography. After doing all your tasks, you need a bibliography to identify if you've got any extra sort of information and where you've got it from. And it is using the Harvard system of referencing. And this is just assessment for the guidelines, just for the assessors, what they expect you to do in task 1. So here, 1.2, 1.2, 1.3, a variety of material useful to the documentary maker, covering organizational structures, roles and responsibilities of external agencies, and an analysis of individual roles and functions. In task 2, 2.1, 2.2, 2.3, written as analysis of legislative framework, so the law impacting on your chosen area, and then you choose materials covering interpretation of legislative frameworks, choose chosen materials providing an assessment of the impact of policies. So you'll be looking at the laws in place here. So, you know, the different types of laws. So we had the Equality Act, we had things like, you know, the Equality Act, Health and Safety Act as well. You know, you need to look at that at work, data protection, Social Value Act, and then you need to talk about the acts as well, the relevance of each of the acts as well. And then the task 3 is 3.1, 3.2, which will be looking at presenting materials, analysis and assessment of the external influences. You know, so there are lots of external influences that you could look at in regards to government. You could also look at external influences, which could be things like, you know, charitable organizations such as Barnardo's, Aged UK, also pressure groups. You know, we looked at pressure groups. Do you remember we looked at pressure groups in regards to an analysis of external influences on the chosen area, and also things like, you know, the different charities that help, and also the big society in this one. Then we looked at task 4, which was an analysis of individual rights and an evaluation of the importance of those rights. So these are things like, you know, human rights. We've all got human rights, why they are important in the health and social care setting, you know, the right to dignity, the right to equality of access, right to choice. You know, as an individual, you have all these rights. So these need to be looked at in regards to task 4. Okay, so have you got any questions in regards to any of these tasks, Eunice?
No, please.
No?
Yeah.
Will you be okay completing these tasks, yeah?
Yes, please.
Yeah, if you follow the tasks and the learning outcomes, that is the best way and the easiest way to complete the assignment.
Okay.
Okay, so
Okay.
have you got any questions or anything, Eunice?
No, please.
Are you sure?
Yes, please.
Okay, it was nice teaching you, and I will probably see you in another session, okay?
Okay, thank you very much.
Thank you, Eunice, and
Have a nice one.
have a nice bank holiday. Thank you.
Thank you.
Thanks a lot. Okay, and just get on with doing the assignments so you can start submitting on LearnerWorks then, okay?
Okay, all right.
Okay.
Okay.
Thank you, Eunice.
Thank you.
Bye.
Bye.